Hey guys, this is Daniel Aragon. So today we'll talk about the different types of hospitals that exist. Some of you might have already have some experience with these types of hospitals because one, you've had probably family members that have gone there. Um, the most common one is the acute care hospitals that we have at every city, and then the other ones are the long-term acute care hospitals. So we'll talk about those two different types. So first one is the acute care hospital, which is the ones that we all know about. Is that if you have cuts, wounds, sprains, you have a car crash or whatever, that's the one you go to. The big one, the main one in your area, in your city. And it's designed and its purpose is to provide acute care that happens very quickly, as efficiently as possible, sometimes not as fast as we would like, but it has most of the diagnostic imaging, x-rays, cts, mris that patients generally need. They have doctors, most of them of different specialties, so they can see a wide variety of things, and if anything is needed, they can address it as soon as possible. They do all the diagnostics, find out what's going on, right? So that's the point of it. Provide, um, find the problem, find solutions, and then once you have the solution and you know the treatment plan, and there's not a high need of requiring further tests, repeat x-rays, or more ct scans, or more imaging, or more procedures, then you are transferred to an LTAC. It stands for Long-Term Acute Care Hospital. So the LTAC, what it is let's say um, a patient had a severe infection, and now we found where the infection is. It's deep in their bone, and we already did everything we could. But now the patient requires um, treatment for 6 weeks of IV antibiotics. But then they also need to have some rehabilitation with physical therapy, and they need a lot of nursing care to take care of the wounds and stuff like that. So, all of that, there's no need for any further CT scans or more imaging or MRIs or a doctor to do a procedure. There's none of that. It's simply long term care that is required for very skilled. It's like nurses to be skilled at the wound care, and also to administer all the medications that they need. This long-term acute care hospitals are are staffed by doctors, by general practitioners that go and see the patients, but they do not need to be seen in a daily basis. However, in an acute care hospital, you are seen by a doctor in a daily basis, and sometimes by different doctors, in a group of different doctors as, that are able to provide care in an interdisciplinary manner. So, if you have severe pain, a general doctor can manage that, but it's not the expert on it. So they call the expert on it in terms of pain management to help out with the pain management medications. Same thing with infectious diseases. Let's say you have an infection in the acute care hospital. All the specialists will come and see you. The surgeon will come and see you. The infectious disease specialist will come and see you, and they will help manage and coordinate all the antibiotics. Now, a thing to know is that long-term acute care hospitals can be more expensive than regular and general hospitals. Why? Because you're going to be there a longer time, right? Despite not having the acuity or having to do all the procedures and everything, but the fact that you're there for an extended amount of time and the care that you require makes it a little bit more expensive. Once you're transitioned to the long-term acute care hospital, then all of those decisions, all those specialists, as they are established and they're practiced and they're done based on their recommendations.